Good morning. My name is Maurice Crespi, Managing Partner of Schindler's Attorneys. We are here today for a COBRA webinar about COBRA. COBRA is a pro bono initiative that's been founded by IQ Business, Engaged Business Turnaround, and Schindler's Attorneys. The idea behind COBRA is that we pool together as many experts in various industries as possible to assist businesses in distress. We've got over 50 partners who've all come on board with a view to providing their services on a pro bono basis by way of Zoom webinars such as today's, by way of our knowledge base. We have the most advanced and detailed knowledge base in the country, and that can be found on our website, www.cobra.org.za. As I said, part of our offering are these webinars to assist you where we can. Today, we're going to be focusing on labor law. We have LabourNet on today. They're going to give us their insights in relation to the labor aspects of what we're dealing with in this time of crisis and potential solutions to the issues that businesses are faced with. In COBRA, we've had countless businesses reach out for assistance in dealing with their employees and dealing with the legal landscape. And just to get clarity in relation to what rights and obligations the employers enjoy, as do the employees. I want to just touch on the legislative framework before I introduce the panelists in relation to labor law and labor contracts. Now, COBRA is not about business rescue. COBRA is about avoiding a business rescue, and it's only in exceptional circumstances that we're going to have to put a business in business rescue, primarily because a creditor is being unreasonable, doesn't appreciate that there's no point sucking blood from stone, and they decide to institute a claim. Then what COBRA does is we implement the business rescue proceedings so that a moratorium comes in place, and that moratorium suspends any claims against the company. Now, having said that, what the moratorium does not do is it does not suspend contracts. Contracts have to be suspended by the business rescue practitioner. And we often say an important take-home is to ensure that the business rescue practitioner is armed with details of the counterparties to the various contracts. And so those contracts can be suspended. So by way of an example, a lease agreement can be suspended, and in certain circumstances, where appropriate, an eviction can be avoided. But where this does not apply is to employment contracts. Employment contracts continue, and employees enjoy the same rights that they enjoyed prior to the business rescue. In fact, they enjoy more rights, statutory rights that are afforded to them in terms of the sections in our Companies Act. And those rights include mainly the right to participate in the business rescue proceedings. Employees have a say in relation to the business rescue plan, and they can vote on the business rescue plan. So we'll be handing over to LabourNet. Our panelists today are, we have Lauren Mostert. Lauren is a Northwest graduate and a Gibbs graduate. She has an MBA from Gibbs and an IR consultant. She graduated in 2005, and she's been involved and assisted small, medium, large, and big corporate entities. She spent 10 years managing operations at LabourNet's Star branch. Lauren left her mark in shaping and developing both the IR products as well as the culture of LabourNet. Moving into an executive role in 2018, she ensures support, compliance, and exceptional service to 3,400 clients serviced by 19 branches across the country. And we have Duncan Carlisle. Duncan is the Health and Safety Executive at LabourNet, having joined the business in October last year. LabourNet has a team of 35 health and safety consultants across South Africa, and they assist over 500 companies in meeting their legal compliance obligations. I had to do some digging. I felt that LabourNet were being a bit modest in relation to their performance, and I found that there are accolades that you can find on the internet in relation to LabourNet. And One I found is they were recognized as one of the top 50 companies in the Nelson Mandela area last year. So congratulations to LabourNet for that achievement. Before I hand over to LabourNet, I'd like to introduce the remaining panelists. We have, see, I was sharing my screen. My apologies for that. We have Gary Barachowitz from Schindler's Attorneys, Duncan Carlisle, as I've introduced, Emma Marseille from IQ Business, and Renee Klopper from IQ Business. I'm going to hand over to LabourNet. Duncan, not sure if you're going to start or Lauren's going to start, but handing over to you. Thanks so much for being here. Please, attendees, ask questions. The Facebook audience, they don't have the benefit of asking questions. So it's up to you guys as you go along. Please ask questions that are specific to you, your business, your employees, whatever they may be, and we'll address them online or on air. Thanks, guys. Over to you.
Thank you, Maurice. And also want to thank COBRA and IQ Business and Schindler's Attorneys for this amazing initiative. I think now's the time that we as consultants, advisors, attorneys, business stand together. Only together we can get through this pandemic and what we're all dealing with. So it's very true, Maurice, what you said. If any company goes into business rescue, it doesn't stop all the requirements in terms of law. The Labour Relations Act is very clear. The Labour Relations Act supersedes all other acts, which would mean that even with business rescue, if you need to enter into business rescue, you must still adhere to the Labour Relations Act in terms of retrenchment, restructuring, Section 189, fair employment relation, fair treatment, fair dismissal, fair termination, all of the above. So nothing would stop us from ensuring that we implement fairness for our staff. So I just want to take you through, myself and Duncan, we want to take you through working through the levels. What do we need to do as employers, as responsible employers, to get us through the level, and of course still focusing on our most important business imperative, which is a business of the future. So we as LabourNet, when all of this happened, and if I think back, it feels like a year ago, I cannot believe it was only 3 months ago, we ensured, number one, safety first, to ensure protocols are in place to keep our staff safe, their families and our clients. That was the most important thing. Our second imperative was business as usual. We had to continue. LabourNet only physically, formally operated in level 4, but in level 5, we were assisting clients, implementing strategies, implementing structure, being very reactive, but to ensure that the employees are fairly treated and the businesses can, whenever their business operation will continue, to ensure they could continue in that level. We ensured that we had to keep our doors open, contingency planning to ensure survival. So all of it was defense mode, fighting this together, but we had to continue. And then I want to focus today, after just taking through a brief summary, is the business of the future, the most important imperative. So yes, COVID happened, lockdown happened. Our brave president have acted swiftly through this to ensure that our country remains safe. It had and will have an impact on our economy, but we now need to ensure from a business of the future we can survive. We are businesses that will continue and we will thrive going forward. But now we need to make the decisions now. Even though it is reactive, and I'm sure some businesses are feeling, there's nothing else to do, but as a business, you can still make decisions. I just want to quickly take us through a few months. March to end May in review. I think we all remember that first day when the first COVID case hit our shores, the first infection, and all of that was all systems go, being reactive. Let's get our staff ready. Let's get our clients ready. Let's look after our own business. Our country was declared, or COVID was declared, a national disaster. The president announced the 21-day lockdown, which again feels like years ago. 21-day lockdown was extended to end April. We don't know what's going to happen going forward. Some businesses were allowed to operate in level 5, not everybody. Then there was the announcement that the lockdown is extended. So I just want to take us back 2 months. So what did we do? Level 5, we had a week. Lockdown was announced. We assisted companies. We had to ensure that their staff are laid off. Could we consult with them? We only had 4 days. or placed on short time. Maybe they could work from home to ensure that they could work from home and all of the operational systems are in place. Maybe there was reduced pay that had to be implemented because as a level 5 company, only half of my clients or quarter of my clients could operate. And then we were allowed to also place staff on forced leave to ensure that they take forced leave. The layoff that I want to now focus on is we had this term that is still in place called supervening impossibility. In my 15 years as a labour law consultant, I've only dealt with it now for the first time. So supervening impossibility, what that would mean is you to an extent ignore the requirements in terms of law. Supervening impossibility is me as an employer want you to come to work, but there's a directive in place by President that said you will not come to work, you're not allowed to come to work. You're not a level 5 company. And me as an employee, I want to get to work. I want to get into transport. I want to come and render my service. But as a result of the directive and the level 5 rules, I'm not allowed to come. So nothing, there's 2 factors that's prohibiting me from providing my service and me as an employer from allowing you to provide your service. So supervening impossibilities, there's nothing I can do. We were forced to place employees on layoff. Of course, TERS came in with a wonderful initiative that they've also changed a lot, put a lot of work through from a technological perspective. TERS came in and said that they will assist staff that couldn't be paid or couldn't afford a salary or couldn't be paid a salary during this period, that they would then assist the staff. So that takes us to the 29th of April. Level 4 directive was implemented. Again, scramble, get our clients' workplace ready. There's a lot more companies that could go back to work in level 4. Supervening impossibility would be then lifted for level 4 companies, and we had to be sure that the staff could come to work, those that can. The directive, of course, was very clear. Everybody that can work at home should work from home. There must be a workplace plan in place. That was an extra E of the directive. Employers must be issued permits to the employees to ensure that they are allowed to travel and to prove that they can render service in level 4. There must be a phased-in approach. On the 1st of May, didn't mean that all staff can be at work. What this meant is I must be workplace ready. There must be social distancing, sanitizing, workplace must be cleaned. 100% of staff couldn't work. There were sector directives that stipulated the percentage to say that some sectors can only 50% of their staff are allowed to work. Ensure there's staggered work times, ensure that there's a rotational system. Individuals over the age of 60, employees and individuals with a known illness, health condition are not allowed to come to work. Should not. Special measures must be put in place. And special measures, of course, is not a mask. It's not extra sanitizing. It would mean if I'm a driver and I'm over the age of 60, I must almost follow the process of an incapacity procedure to ensure that I can adapt the individual's work to keep them safe. So maybe do contactless delivery, or can the individual work from home? Can the individual not work from home? Can they work in an isolated place? If they can work in an isolated place, but they use public transport, I must then ensure that I'm assisting the employee through a process of incapacity. Also, from a workplace perspective, I must designate a compliance officer to ensure all of this is put together, my workplace plan is in place. But I think then the important question is, and I'm going to hand over to Duncan here, now I've got this workplace plan, I've got it in paper. Is that enough from an occupational health and safety perspective?
Thank you, Lauren. And once again, thank you for the invitation to be able to speak this morning, and obviously welcome to everyone who's listening. So in terms of the question, Lauren, that Lauren's posed around the workplace plan, there's certainly a tremendous amount that needs to be implemented from an occupational health and safety perspective. And the workplace plan is one component of that. So if we also just go back a month or so in terms of what's transpired from an occupational health and safety perspective related to COVID. The initial health and safety directive was published towards the end of April, and that was a very detailed document that obviously spelt out what was required in terms of organizations from a COVID compliance perspective. From there was a summary directive that was published at the beginning of June, and to a large extent it confirmed what was included in the more detailed directive at the end of April. There were some minor changes to that, but overall things stayed relatively the same. And part of that is obviously the workplace plan, the appointment of a compliance officer, and what is required in terms of both going back to work and what the responsibilities of that compliance officer are around putting the plan together, and then obviously the day-to-day compliance within the workplace once everyone gets back into the office. But I'll touch on that a little bit later. What I'd like to just go through is in terms of the directives, I just want to highlight some of the key or salient features in those directives. And what we've been advising our clients from the start around the occupational health and safety obligations in terms of COVID is that there's so much information out there and it can get extremely confusing, and it seems to be changing on a fairly regular basis. So we keep reiterating the importance of applying some basic principles in terms of your overall compliance. And the basic principles really is what Lauren touched on around the, well, firstly, the work from home policy. So where possible, obviously, we want to try and ensure that employees work from home. If that can't be accommodated, obviously, then we need to look at, firstly, those individuals that are over 60 years old and those with underlying health conditions. In those situations, then, you know, they have to have a work from home policy, or additional measures need to be implemented for those individuals in the workplace. It's no longer it's not okay just for them to have necessarily additional PPE. You know, certainly for people over 60, you need to look at whether you can accommodate them in their own office environment and make, you know, exceptional control measures that you need to implement to obviously accommodate them in the work environment. In terms of PPE, obviously there's been a lot mentioned around the PPE requirements that need to be provided to employees. And in terms of the directive, employers need to provide the employees with 2 cloth face masks. That is a legal requirement, and those employees need to wear those cloth face masks or face masks within the workplace at all times. The other aspect is hygiene, and obviously the whole issue around hand sanitizer, making it available, and just creating a culture within your organization of high hygiene, washing hands, and obviously utilizing the hand sanitizer as far as possible. Then the physical distancing, once again, the reference to the 1.5 meters, critical control measure that needs to be implemented. And as part of the responsibilities of your COVID compliance officer, an important part of that is obviously to ensure that those physical distancing rules are applied throughout the organization. That's not only at people's workstations, but that obviously applies when people arrive at work in the morning to ensure there's no, say, congregation of employees within the reception areas during the tea breaks, lunch breaks. So those control measures need to be implemented across the organization. We then look at transport, and if companies are providing transport to their employees, then obviously, you know, the number of employees that are in those vehicles, the cleaning requirements around those obviously needs to be enhanced and improved. So transport, both from where the employer is providing transport, but then also in terms of identifying those employees who are utilizing public transport, because once again, that increases the risk profile, and you need to see whether you can't put other measures or controls in place to limit the number of employees that are obviously utilizing the public transport. Then communication, once again, a key control measure. There's obviously a tremendous amount of anxiety from employees at the moment around going back to work, potentially being exposed. And so we keep advising our clients around the importance of a detailed communication plan that needs to be implemented. And that entails both the communication, should you have a confirmed case in the workplace, how you're going to communicate, who you're going to communicate to. And that obviously, if it's properly planned, obviously if you are faced with that situation, then it would typically be enhanced the way you do communicate to your employees. So just to go back, as I mentioned earlier, to try and not confuse the situation, given the amount of information available. It's really the work from home policy, the PPE that needs to be provided, high hygiene, and ensuring that there's messages up, posters up, and keep reinforcing the message across your employee base, the physical distancing, safe transport, and then obviously your communication plan across your organization. One of the other aspects which we've seen, and it came across in the summary directive, was the importance of not forgetting about your normal health and safety responsibilities in terms of the Occupational Health and Safety Act. There's such a tremendous focus at the moment on COVID, obviously, and but that doesn't negate the importance of still ensuring that from a general legal compliance, occupational health and safety perspective, that those measures are being met and controlled, because we've seen various inspections from the Department of Labour across our client base. And whilst their focus and their checklist is very much aligned to COVID, obviously they do not neglect all the other aspects of the Occupational Health and Safety Act. The other, what I'd like to do now is just take you through some of the more practical aspects of what you need to do as an organization to be compliant. So we've touched on the directives and the legal requirements, looked at really the basic measures, but if we look at now just a step-by-step process that you as an organization can adopt in ensuring a level of compliance. The first issue is you need to look at whether the directives have really split organizations based on size. So any company with less than 10 employees, the onus and the requirements are a lot less stringent. So I think just bear that in mind. If you do have less than 10 employees, my focus is going to be on larger organizations, those with above 10 and less than 500, because once you go above 500, there are also a number of other requirements in terms of risk assessments and the fact that those then need to be submitted to the Department of Employment and Labour. So from an organization perspective, the starting point really would be to appoint your compliance officer, and that compliance officer has a broad range of responsibilities, obviously the development of the workplace plan, and then just general compliance, day-to-day compliance within your organization. The advice then we're providing to our clients is really to conduct a gap analysis, and that gap analysis will enable you just to identify the areas where you need to focus on. It needs to be risk-based in that you need to focus on where you believe the biggest, say, deficiencies in your control measures are. And the gap analysis should identify that. And then obviously the focus can be on those areas in terms of controlling and mitigating and allocating resources or funds if required to closing those gaps. Then there's obviously a basic framework in terms of your COVID policy. So develop a COVID company policy, develop a safe operating procedure that will define really in terms of the cleaning process that needs to happen within the organization on a day-to-day basis. It will identify the key appointments. In some cases, you might want to appoint a COVID response team, for example. So not just the compliance officer, there might be additional resources that you want to allocate in terms of responsibilities around COVID management. It'll also define your some of the control measures that you will implement, the screening process, the day-to-day screening of employees and how you're going to go about that. And then obviously need to conduct a workplace risk assessment. The workplace risk assessment, once again, legal requirement, very clearly defined in terms of the directive, what is required in terms of that risk assessment. And the risk assessment is really where you're going to identify those control measures that you're going to implement. And a lot of them I've discussed in the previous, earlier on in terms of the physical distancing, the PPE. Those will all be certain control measures that need to be implemented, but there'll be additional controls. So you'll start with your engineering controls. You know, what type of air conditioners am I allowed to have my air conditioners on? Do I need to implement physical barriers because I can't apply the physical distancing? If my employees, for example, in a laboratory, it's very difficult to apply the 1.5 meters. So you might have to then have additional physical barriers that you then adopt to enhance the control measures that you have in place. So you would start with your engineering controls. You would then look at your administrative controls, which really is all your documentation. It's the training and upskilling. So a critical component to this, once again, is the induction and awareness training that you're going to be providing to your employees. It goes back to your communication plan and goes a long way in terms of the overall information and awareness that as an employer, you have a responsibility to provide to your employee base. And then finally, we look at PPE as part of that risk assessment. PPE really, in a lot of cases, is not seen as a control measure because there are a lot of deficiencies in terms of relying on people, ensuring that they wear it correctly. But still, in this instance, we do obviously factor it in, given that the requirements around the cloth face masks and the process behind that. In terms of the medical screening, there is a requirement that all employees are screened on a daily basis, and that includes visitors as well. As part of that, they need to complete a self-assessment questionnaire where you would ask them a series of questions, obviously related to the symptoms, COVID symptoms, and there are about 8 odd symptoms that those employees would need to confirm that they're not suffering on from a daily basis as they come into the organization. As part of that, their temperature should also be taken, captured, and obviously, provided they don't have any of those symptoms, they would be allowed into the working environment. And that process should be applied for visitors as well, and try and keep visitors to a minimum. Obviously, try and limit visitors coming into your environment, limit the number of contractors coming in. But if they are coming in, then obviously you need to follow the exact same process as you would for an employee. If an employee is displaying symptoms, then there's a whole new process that needs to be followed. And once again, this has been quite prescriptive in terms of the directive that has been published in terms of what needs to happen should one of your employees either display symptoms when they arrive for work in the morning, or obviously display symptoms during the course of the day. And we get a lot of questions around this because given the broad range of symptoms that have been defined, it's very difficult sometimes to act in terms of what's required if someone is merely displaying one of the 8 symptoms that you don't think is necessarily a result of COVID. However, in the directive, they don't define the fact that it needs to be 3 or 4. They really just refer to a symptom. So if that is the case, then there's a process you need to follow. Firstly, you need to isolate the employee. You need to issue them with a surgical mask. You're required to inform the COVID hotline, and then arrange for the worker to be transported, if they don't have their own transport, to a testing facility for them to be tested. Obviously, if you are providing the transport, you need to factor in the risk of the individual who will be taking that employee to a testing facility. So you just need to consider what control measures, what type of vehicle that needs to be used through that process. If they are tested positive, then you need to inform the Department of Employment and Labour, and you need to inform the Department of Health. Then obviously it's about cleaning the area that employee has been in and identifying those employees who are in close contact with that employee if they've tested positive. So if they've tested positive, there's a process that you need to follow through, and the summary directive really has explained that process now is defined by whether the other employees who are high risk or low risk in terms of the transmission, having been in contact with the positive case. And the high risk employees should then obviously be sent for testing. The other employees, low risk employees, should be self-quarantining. And if they don't display symptoms, then they can come back to work. But it is once again a very difficult situation, because for an organization to be able to identify across their business who was low risk and who was high risk becomes very subjective, and there's a lot of gray involved in determining which employees should then potentially go for testing and those that can self-quarantine. So the advice we're really providing our clients around this is that if you do have a positive case in your workplace, then the employees who have been in close contact with that employee, we believe those employees should all be sent for testing, and that will obviously fast track identifying potentially who else has COVID-19, and then you can implement certain other controls in terms of potentially widening the contact tracing, ensuring you can clean a larger area within the workplace. So that just takes away any kind of subjective type assessment on who has been in close contact and who hasn't. There's no legal requirement to close your entire business down should you have a positive case. It will really just be identifying a certain area. It obviously depends how big your company is as well, and who potentially has been exposed through that process. Employees can only come back, employees who have tested positive can only come back into the workplace once they have received a medical report. They need to self-quarantine or isolate for 14 days. They will then get a medical report, and provided that's all clear, they're allowed back into the workplace. There are certain additional controls you need to implement, such as them wearing a surgical face mask, and the physical distancing requirements needs to be increased for all those employees who have tested positive and then are back in the workplace over the period once they've got a medical report. But I'm going to hand over to Lauren now, because Lauren will just detail the requirements around the IR issues should you have a confirmed or suspected case in the workplace.
Thanks, Duncan. So I think it is so important, implementation, screening, ensuring your staff are kept safe. And why do I need to keep my staff safe? I need to ensure my staff are kept safe so they can look after my clients. We've seen in so many cases from a work perspective how quickly the infections rise, and which means you don't have staff to deliver services to your clients, to look after your clients. In terms of illness, if I do have a positive case at work, I've done all the requirements in terms of what Duncan presented. Also, just keep in mind a positive infection at work would fall under COBRA, the Occupational Health and Safety issue. So if I do have a positive case, that does not mean I can terminate the employee, or if the employee's from a health condition the COVID impacts the employee's ability to work for future. So we all know it's a 21-day isolation. After 21 days, the employee should be able to come back to work. But let's say I've got an employee who's got issues, future issues with regards to the infection, or as a result of the infection. I cannot terminate the employee's service as a result. I would have to go through a normal incapacity process for ill health, as envisioned in Schedule 8 of the Labour Relations Act, where I would consult again, see how I can adapt the employee's work. The employee cannot come to work because they're too ill. Can they work from home? Is there any way that I can adapt, maybe shorter hours, half-day work, with, of course, the relevant pay? But from an employer perspective, I cannot terminate as a result of. The directive that came out on the 4th of June is also very, very particular on discrimination as a result of COVID, that nobody can discriminate against an employee for contracting COVID or being tested positive for COVID. I see in the Q&A somebody asked, is there a negative stigma? We haven't seen it from a work perspective. We haven't seen it in a employee perspective. So I'm going to answer no, not currently. But I also think the more infections there are, that it might be, or maybe it's because of the amount of infection, that's why there isn't a stigma, negative stigma attached to it. Then we were informed of level 3, 1 June, more than 8 million people were allowed to come to work. And I'm saying allowed in brackets, because that would mean, yes, staff were ready to come to work. As an employer, I had a lot of things to put in place. There were tick boxes I had to complete. I had to ensure there's a workplace plan. My workplace is ready. You also saw now with the advanced level 3 regulations that pertains to restaurants and hair salons, hairdressers, beauticians, that there's requirements in order to put in place. The requirements for hairdressers have been regulated. Book online, no queues, 1.5 meter distancing, ensure there's masks for the employee, the client, and also the beautician. Restaurants, we haven't received anything yet. We're still waiting for that, but there's now more regulations in place. So 1 June, as per the level 4 regulations, it's not necessarily that everybody can come to work. As an employer, I need to ensure that people that can come to work or can work from home should work from home. There must be strict compliance to health protocols. There must be a phased-in approach. I cannot get all my staff on the same day. If I'm a call center, I must ensure there's 1.5 meter spacing. So I must ensure that there could only be maybe half of my staff. We would then not be able to rely on supervening possibility, but as an employer, you would have to implement a form of a selection criteria through a consultation process as envisioned in section 189, which deals with restructuring, redundancy and retrenchments. Also, I need to ensure that return to work is done in a manner that reduces infection. So stagger workforce, rotation system, that less people at the same time uses public transport or on the road or at my office. Work from home, that's a very interesting concept. So what does it mean if I work from home? Does that mean that all my rules, regulations, performance standards are ignored? No, of course not. If I work from home, I must still rely or still ensure that I adhere to the rules and regulations, my working hours, my performance, my standard of performance, my level of instruction and adhering to instructions. So what that would mean, if I am late for work, if I don't log on at 8 o'clock for a meeting, because whatever reason, I can be disciplined. Always use the analogy that me sitting in front of my laptop at 8 o'clock and logging in is exactly the same as me getting into a car, driving to work and reporting for duty at 8 o'clock. So all the normal rules and regulations adhere to. We just need to, as a business perspective, ensure that we've got performance standards. We don't have the luxury of ad hoc management or ad hoc leadership. As an employer, you need to actually plan your leadership. I would need to now look at data, look at performance standard, maybe have regular check-ins, maybe have better KPIs to ensure that I know if my staff are performing, because I can't look over their shoulder. I think now the time is to ensure that we are output driven and not face-to-face input driven, that we can actually know that we can adhere and complete with our businesses and have a business of the future, which is very important. Just to make another mention in terms of the level 3 regulations and directive, there is still a focus on employees over the age of 60 and employees with a known medical condition, that we need to facilitate their safe return. That may include special measures. It would go through incapacity process. We cannot ignore it as an employer. The directive is very clear. The directive is an instruction saying that you need to ensure there's special measures and that you've really looked at all the requirements. So that takes us through what next. I think now it's important that we cannot only focus on moving forward, let's also focus on moving backwards. So the backwards focus would be, I've gone from a level 5 to level 4 to level 3 to advanced level 3. What's going to happen in level 2? More clients are going to be able to operate, more companies will operate. I need to start showing that my staff are coming back to work. I can't rely on the directives of level 5, 4, and 3. All my staff are now required to come back to work. Those that have laid off because of the phasing in, I need to now ensure that I'm at 100% capacity. That, of course, doesn't stop me from looking at my business moving forward. So if I now need to ensure I'm at 100% capacity, I must also ensure that I'm moving forward and making plans in terms of the structure of my business, the amount of people I need, the amount of people I need for the clients that are still operational, the amount of people I need for a business that can be profitable going forward. So I cannot rely on supervening impossibility. I cannot rely on this concept where the rules doesn't exist because of both parties cannot come to work. My staff are putting their hand up saying, I want to come render service. I need to now show that, can you render service? Is it profitable for my business? And I need to make the hard decisions now. So our strategic imperative number 4 is, what do we need to do? What should my business look like? What do I need? What type of structure do I need? I've got half my staff that will work from home because maybe I've given up my office for a cost saving. I need to now ensure that I've got the right amount of staff to service my clients and to still ensure that my SLAs are delivered. But I need to take into account that all of this costs money. As Maurice said in the beginning, that from a business rescue perspective, if I'm forced to take that route, I cannot ignore all the rules and regulations. I need to still adhere to Section 189, which is a retrenchment process. And that doesn't mean that only when I go into business rescue. That can also mean that now I've got the opportunity to restructure for a better business, for a more efficient business. I can look at output. I can look at there's no time wasted in travel. Teams, online, I can actually still get the same amount of work out, just as long as my staff have the necessary resources and there's still support from a business perspective. But the important thing is, if I need to restructure, there's a time limit. I need to consult. After consultation, if there's no other option than to terminate as a result of redundancy, I would then need to issue notice. After the notice period, I would also need to pay severance pay, which I cannot get out of. There's no rule to say I can get out of severance pay. There's no agreement to say I'm going to forfeit severance pay. Of course, again, business of the future, I'm also allowed to make decisions in terms of how I'm going to pay my staff. Should I do, if I have salespeople, maybe do higher commission, low basic, high commission, and drive your actual sale. If I have staff that's going to work from home and maybe the output is half, I can go through a restructuring process and actually pay less. Maybe do a variable pay that the employees are paid according to output. Or I could do that the employees can only work for 4 days a week. It doesn't mean I need to pay for 5 days a week. I can, through a restructuring process, then pay them for the amount of work done. I think just the important thing is that none of this is done in a day. This comes with planning. So I need to ensure that I'm doing my planning now to ensure that I've got the right business that will service my clients to ensure that I can still be profitable. If I am a bigger business that employ more than 50 employees, and I intend, or my proposal is to retrench more than, my intention is to retrench more than 10 employees, sorry, this is now working from home, apology. And my intention is to retrench more than 10 employees. It is a Section 189 capital A procedure. What that would mean is I have to consult for 60 days, then only pay notice and then severance pay. So that's why I'm saying planning is the most important thing now. But I can plan for a better business. Duncan, that's from an R perspective. That is from our business of the future. How do you think all of this will have an impact on OHS and the future of OHS in business?
Yeah, thanks, Lauren. And I mean, it's a very interesting time for the occupational health and safety industry in that, historically what we've seen, especially with small, medium enterprises, is very much about basic compliance. So organizations would typically implement a health and safety management system purely to comply with the requirements of the Occupational Health and Safety Act, which would then obviously mitigate any risk, especially if they were, if the Department of Labour arrived and conducted an inspection, or if they had an incident on site, at least they had minimum legal compliance in place. And obviously, a lot of companies out there, ignored this completely and had little to no compliance to legislation in place. What we've seen recently is obviously with regards to COVID, the fact that companies now realize the importance of implementing certain basic management systems purely just to mitigate the risk of having a on-site positive case, because the impact to their business now is obviously significant in that in some cases it would close the business down. So we've gone across our clients from a point of basic compliance to now organizations looking at what best practice measures can be implemented to obviously mitigate this. And so I think it's going to change our industry forever, in that we are engaging at a far higher level now, where previously it was often difficult to engage at the executives. Health and safety was potentially seen as a bit of a grudge purchase, but that's changed, and that's obviously bodes well for our industry, but also just general compliance and awareness around the importance of occupational health and safety. Historically, it was very much about safety. If we looked at the weighting towards where our clients' focus was, 80% safety, 20% health. And the reason for that really was that safety was immediate. Someone would hurt themselves, and obviously it was exposed straight away, versus health issues, which typically progress over many years. So it's not really seen immediately. But with COVID, it's now really focused around health issues and a very heavy weighting towards that. So we've just seen a big movement with our industry, and hopefully this just creates, if there's one positive, it just creates a lot more awareness around the importance of health and safety measures, and the fact that if you implement good health and safety practices within the workplace, ultimately, it's an investment, and ultimately it should reduce incidents and should save a company money in terms of those incidents, should improve morale across the organization. And so we've always said that health and safety is an investment, and I think that's what we will see going forward during this period. So that's just from my side in closing. Once again, thanks very much to COBRA, and I'll hand over to Maurice for closing.
Yeah, brilliant. I've got some questions, so we won't be closing anytime soon. The first question, whilst I've got you on, have you considered the criminal sanctions that may apply in circumstances where an employer or business does not comply with the COVID regulations? And I have provisions such as Section 80 of the Safety, Health and Welfare Act, which specifically says that directors can be held liable. Now, there's also a case where a individual was arrested for attempted murder because the individual intentionally sneezed on a person. And if that person dies, that converts to murder. Now, I'd imagine also in the workplace, negligence, if somebody dies as a result of negligence, that'll be culpable homicide. So I think it's important to highlight that it's actually can be very, very serious. You could actually be charged with culpable homicide. Have you got any thoughts around that?
Yeah, it's an interesting topic, obviously, and I think your reference in terms of the sneezing, I think, happened in the UK, and obviously, yeah, there's a lot more focus around occupational health and safety there, and the Manslaughter Act, in that, you know, directors can be prosecuted for negligence within the workplace. Unfortunately, in South Africa, we don't see the same kind of penalties that are associated with those type of incidents. Obviously, we've also got COBRA and workmen's compensation, you know, in terms of employees who do contract COVID in the workplace. So typically those would be covered through workmen's compensation, unless there is an element of negligence. And in those cases, then obviously your executive, your MD is, your CEO ultimately, as your 16(1) appointee within a workplace, is ultimately responsible. And I think through this process, it will be interesting if the Department of Labour, through their various inspections, and they've been extremely active, with the number of inspections that they have been doing around COVID, it would be interesting to see whether anything like that does transpire. But once again, I think, as we know, to actually end up having a successful prosecution around anything would be extremely rare, and I think difficult, in that COVID, once again, in terms of the proof of where the individual ended up contracting the virus is also quite difficult. So I'm not that optimistic that we'd see something like that in South Africa, but if we did, it once again would help us in terms of driving just overall compliance and investment in terms of our product.
Yeah, I often say when it comes to Uber, that using Uber, in a sense, is an insurance policy against a charge of culpable homicide. If you're driving and you kill somebody, you'll get charged and you can go to jail for that. Whereas if you use an Uber, you've insured yourself. It's not possible because you're not driving. Now, doesn't the same principle apply in your mind to working from home? Isn't it safer from an employer's perspective to say, guys, work from home, and then there's that limited compliance that kicks in? What would your advice be?
You see, the employer is still responsible if you're working from home. If he's aware that you're working from home, and he's essentially approved the fact that you're working from home, then workman's compensation still kicks in with your home being your office. And the counter argument to that is the fact that the employer has very little influence on your home environment. So versus at the workplace, where obviously certain controls and processes can be implemented to mitigate risk as far as possible. So it's a difficult one. I don't think it just depends on the type of environments you're working on, whether they're at home or whether they're at the office. And I suppose how seriously your employer takes health and safety and the investment that they're willing to make in it.
Yeah, I think you hit the nail on the head. It's really it's more of the employee's obligation when they work from home because of the control element. So it's unlikely that the employer would mess up when it comes to, let's say, the cleaning obligations, maintaining the environment. So that's an interesting take home. I've got one for Lauren. Lauren, you made mention of Section 189A and the threshold in relation to employees. But now, when it comes to the threshold, 10 employees, over 10, you've got to follow the 189 process, which has prescriptive time periods. In COVID, how do you know? How do you contemplate whether you're going to be employing 10 employees. You say you must plan, but if you don't know, because you don't know how long the lockdown's going to last, you don't know whether there's going to be a second round, how does one plan realistically?
Of course. So if I'm terminating, then it's a 60-day. So let's, for argument's sake, I have a business, I've got 50, 100 staff. 50% of my client base is still on lockdown into level 2 or 1. The option then would be I can then do a agreed layoff. So then the requirements won't be a capital A, so they need to consult for 60 days. But of course, from a business perspective, if I cannot just wonder, I must still physically know how many people I would want to, or need to, not want to, sorry, apology, I would need to terminate or make redundant or maybe change their working hours. So to answer your question, it is very difficult. I mean, to do a risk adjustment strategy, and there's lots of literature on it, on the industries that might be affected and the number of industries and what type of industry. So what I would then suggest is, if I then look at a business of the future, I take a risk adjustment strategy. I then look at the percentage of business that I might lose, how many people I would need. And then again, if I enter into a capital A, that would be worst case. I still have 60 days to consult. If anything changes, if my risk adjustment strategy was incorrect and those businesses are coming back, like we've seen that the restaurants in Natal are coming back in level 3, where we assume will only be level 1, I can then revert back and maybe affect less people. So at least during a consultation process, I can still knee-jerk, or I don't need to knee-jerk. I can start the process, consult, and then revert back and maybe have less people affected. But then at least my 60 days are used and it's not wasted. Where if I wait until a level 1 and then decide, oh my goodness, I need to terminate, and it could be or lead into a capital A, that's when the issues come in, because then I need to pay staff, consult for 60 days, and still have 1 month notice and severance.
And I think what you've inadvertently highlighted is the importance of the COBRA network. You'll have seen that it's relatively technical. Certain aspects we're making mention of risk analyses that need to be conducted, and LabourNet are specialists at that, and importantly the COBRA partners. So they will provide those services to businesses in distress. All you'd need to do is contact us, send an email to info@cobra.org.za, or just find us on our website, find me on Schindler's website. My email address is crespi@schindlers.co.za. Send me an email. We'll also be posting Lauren and Duncan's details on the COBRA website, so you can look there for them. I'd like to thank LabourNet. I'd like to thank Duncan and Lauren for taking the time today for a most insightful webinar. We are going to ask you to come back. Thanks so much to the remaining panelists for being here, and in particular, thank you to the attendees for making the time. Please join us tomorrow. We got another webinar. Tomorrow we'll be dealing with, where do I have it? We have join Catherine Young, founder of ThinkRoom, and guest Keith Van Zyl and Kumran Padiyachi as they discuss how to stay flush in the pandemic rush. So that'll be interesting, and that's tomorrow at 10 o'clock. Please join us then. Until then, have a fantastic day and goodbye.